Okay. Hi, good afternoon, District 7 citizens. My name is Warren Wheaton, the District 7 legislator for the Kiowa Tribe. This is our monthly service webinar where we focus on a service that the Kiowa Tribe currently offers our District 7 citizens. Today, I've got our guest with us, Jeanie Granado. She works as the director of the Community Health Representative Program, commonly referred to as CHR in the Kiowa Tribe. And we're here just to visit with her and ask her some questions about the program itself and what it does and how the District 7 citizens might take advantage of some of its services they offer. Or if you have family in and around the Carnegie, Anadarko area, how do they get help from CHR? So good afternoon, Jeanie. Thank you for joining us today.
Hello, thank you for having me today. I appreciate it.
Yeah. Well, we'll start off this webinar. Just give us a quick introduction of yourself, who you are, how long you've been the director and of the Community Health Representative Program.
Okay, well, like you said, my name is Jeanie Granado. I've worked for the CHR program going on almost 6 years now, and I currently became the director back in May, the end of May, and I'm learning more about the program on the other side of it. And we have it's a good program, and I'm really excited about the position and being able to improve the services that we have and build upon that, and be able to bring more to our people, and under our scope of work that the CHR program is supposed to be doing.
Thank you, Jeanie. So for this service webinar, if we have any citizens that join in online, we're going to ask that you put in your questions down at the bottom and the Q&A box. Just click on that, submit your question, and either we'll ask the question to Jeanie here today, or if Tara knows the answer, she might. Tara's also joining and monitoring our question and answer session. So if she can answer that question or make sure it's asked, she'll be letting me know. So Jeanie, just what is a CHR?
So the CHRs are the community health representatives, and we assist the tribal members and our tribal communities, Native Americans, with the community health work. Basically, what that means is CHRs are transporters. We do transport our clients to and from their doctor's appointments. We do that within a certain area. Each CHR program and do have their own service areas. So currently our service area for the Kiowa Tribe is all of Kiowa County, basically from, east to west. And then from Highway 9 south to the Comanche line. So that's basically our boundary right there. That's what areas we service, because then we go into other tribes' service areas like the Comanches and the Wichita's, Apaches. We all have our service areas. So when we're setting up our transports and things like that, we stay within that service area. If a tribal member calls and needs transport outside of that service area, we try to coordinate or refer them to the service area that's within where they live. So whether that be Comanche, Wichita's, or whatever. And we also assist them in setting up their doctor's appointments if they need that. We have a lot of times we might have somebody that calls us with an appointment, and let's say we're already full that day. We already have scheduled appointments going on that day, and we cannot take them and transport them. So we offer them the opportunity to let us reschedule that according to our schedule, so we can get them to that appointment. And it doesn't, affect their routine schedule of their medical appointments. Sometimes we are able to coordinate with the fast trans for some of our local transports, like Carnegie, for instance. Let's say we're out on transport that day and we're unavailable for that, and we have a tribal member or someone here that needs to get to the Carnegie clinic. We will coordinate that with fast trans, and we will cover that service because it's a medical transport and we're utilizing their services to help us out. So we kind of coordinate and partner with them in that. And that's something that we're really grateful for, that they're able to help us in that area. Doesn't always work when it's outside, like to Lawton or Oklahoma City. Of course, they can't transport that far for us. So we have to try to reschedule those appointments. If we have a veteran, for instance, that calls and needs that service and we are unable to transport them, we will work with our veterans office to see if we can help that tribal member get to that appointment by coordinating it with the veterans office to take them to the VA or wherever they may need to go. So we have some a lot of collaboration with them that we can, help so it doesn't affect them outside of their needs, what we have here going on if we're busy.
So just to clarify, you said the service area is Kiowa County. Is that your service area?
Kiowa and parts of Caddo County. Yeah, it's all of Kiowa. When I say all of Kiowa County, it's like from Hobart on, east and west to Fort Cobb.
Yeah.
And then Caddo and Kiowa.
Okay.
Let me rephrase that.
Well, thank you. So how many employees are currently working in the CHR program?
Currently, we have 3. Well, we have 2 transporters, 2 CHR generalists right now. They're fairly new, so they're being trained. They're getting their training in, and we're going to start doing our home visits. So when I say that, it's currently something that in the past hasn't been done based upon the staffing and all. So I'm hoping to grow the program so we can provide more of that service. And I'd like to get our CHRs trained so they can, come in and do home visits. Let's say, and what I mean by home visit is, let's say you have a tribal member or a loved one that's within our jurisdiction, within our boundaries there, that they got out of the hospital, and maybe, you want us to come and check on them to see, how they're doing. We can come and check on them. We also can do a home visit just to do like blood pressure check, maybe a finger stick, kind of see how they're doing, if they have any needs, if there's any resources that we can provide for them and refer them to. And also, maybe check out their medications and such to see if, they're doing they have all their medications. We can go and do a medication pickup. If they have some medications at the pharmacy, they have no way to go get them, we can pick them up and bring them to them. So that's another service that we provide. Our home visits will come as the training comes along. So once they get to that point where, we can start going out and doing that. They're fairly new. We have one that just started back in May as well. And no, I take that back. I'm sorry. I apologize. Back in March. And the other one, neither one of them have been here a year yet. So we have some training that needs to be done before we can send them out to do that.
So what are some resources that are available to our District 7 citizens currently that live outside that service area? Is there any services that they might be able to tap into?
The services that we could provide for them would be actually, as far as the CHR program, would be to offer them outside resources. Like, let's say you have a tribal member that calls us from Tulsa and they're in need of homemaker service, home health or something like that. We can reach out, we can gather some information from them, we'll let them know that, they're outside of our service area, but we can make some phone calls. We can help set up some resources for them, try to make that connection, for them to get those services in the areas that they live in. Since they are outside of, go ahead.
I know the other tribes probably cover the Tulsa area, so that's a good point, just calling the other tribes who might have a CHR program in that area, and they might be covered, right? Is that correct?
Yeah, that's correct. Let's say that we have somebody in Tulsa but they're under the creek, they're within the creek boundaries. Well, we can reach out to the creek CHR program, talk to them about what our client needs, what they're looking for, and see if they have availability and have someone, you know, that can come out and help them or refer them to them and make that connection and all for them. Now, we also have, under the CHR program, we also have the special diabetes program for Indians. So we have funding for that. Now, that right there does help our citizens that are diabetic. They can apply for services through our program. We currently have eyeglass applications and shoes and dentures, and we're limited on the dentures, and we have some equipment. The fundings for those two are on the equipment. We currently do not have funding for the dentures. We're almost at the end of our funding for that. And our eyeglasses and shoes, we're still processing applications for that. Now, that right there being said, we have criteria that you have to meet. You have to show proof of diabetes in order to qualify for those services. And that is a doctor's statement that says that you're diabetic. And once we make that determination, then you are eligible for those services. And we can help. Those services, I say, like our Tulsa, Oklahoma City area and all, we have a lot of clients that go to the Oklahoma City area office. So that would be in your district. Is that correct?
Yes, that Oklahoma City is in my district, so that would be one of the communities we might be able to help find service to.
Yes. So that we work really well with the Oklahoma City Indian Clinic. So we have a lot of tribal members that go there, and they will request eyeglasses. So they get their eye care there, their vision care there, and they'll even pick out their eyeglasses. So the collaboration with them is really good. They know exactly what we need. They make sure that the application and all of the paperwork that we need to process the application is given to us, so we can try to get that processed and get them their help with their eyeglasses. With that being said, the amount that we help with eyeglasses is up to $200. So anything over that would be the client's responsibility.
With community health representative, the program itself, are y'all, what program are y'all funded through?
That is the IHS funds, and it's
Okay,
HHS.
so it comes
So
through Health and Human Services, and is that an annual funding cycle?
yes, it's a 3-year contract with the annual funding agreement.
Okay. So I guess like, is there any need for CHR program to have, are y'all trying to update your technology and updating your the way you serve your clients right now? Is there anything that is it kind of a challenge for you working in the CHR program?
It would be currently we are trying to upgrade that. Yes, as like I said, once we begin to start getting more training and getting our CHRs out there, I'm hoping to maybe provide them with technology like a tablet or something where they can do assessments, surveys, and right there at their hand. So that would be something that we would be working on in the future to try to secure funds to be able to provide that service for our CHRs so they can use that in the field. So we have a little bit of a challenge right now. We're just based on the funding that's already there and kind of working within that to, with the funds that have already been given the budget, staying within that budget. So
Are
it's.
are there
Go
any
ahead.
other organizations or tribal programs that y'all currently partner with that might be really good information to have for the citizens listening in?
We have been, okay, so one of the things that we will be doing, and it's upcoming, is we're going to be doing a walking program that's funded under the Strong Heart Study. And that is called the STAR program. And there's been a lot of contracts, a lot of paperwork and stuff and all that's had to been done, with the RB and everything to get the approvals for that. We did get the funding for it, but we haven't been released yet to actually start recruiting people. So right now we're just advertising that we're going to have this program, and we're taking names and numbers. So once we get the list, once we get the approval from them to go ahead and start recruiting, then we'll reach out to the participants that are interested on the list and start the recruiting process. And what that is it's a 12-month commitment. It is a walking program. We will assist, let's say there's a walk in Oklahoma City and they're on the program. What we do is we pay for that registration for that walk. So the participants will not have to incur that cost. It'll be covered under this funding. So that's one of the partnerships that we have right now, is with the Strong Heart Study. Another one that we are currently working on, I won't know for sure yet if we have it, but I'm praying and hoping that we get it, is some funding for some blood pressure cuffs. And, that would be to give out to our citizens, and we'll develop the criteria and everything for that. And we will advertise that once we secure the funding and all, and then we'll put the information out there on our website. And that would be open to, any tribal member, as long as they meet the criteria and stuff and all, we can get that we have that need, so that would be blood pressure and stroke, prevention. So.
Well, good. Thank you very much. And I think that's important, those services. I always talk to different program directors. We have a lot of citizens that don't live in the service area. So any kind of resources we can provide for them, we try to connect them with if they're eligible for them. So in the CHR program currently, what do you see? Is there any future projects that you'd like to see the tribe support the CHR in their work?
Yes, I'm looking to grow our staff so we can provide more services to our people. And we do, outreach I feel like is a big thing, providing outreach services to our clients. And that would be with health education, nutrition education, having the staff to be able to do that. Right now, our current workload of transports is top heavy. We do a lot of transports. There's a lot of need out there with our clients within our service area to get to and from their appointments. With that being said, the CHR program is transporters of last resort. So we're trying to make our, help our clients be aware of the fact that, we are there for them. We do want to get them to their appointments and all on a timely manner, but also, be aware that we have limited staff here. So in order to meet those needs and also meet the scope of work that we're needing to do as far as getting the healthcare education out to them, we're going to be increasing our outreach, increasing our education to once a month, focusing on some different healthcare topics that we will be providing and stuff, and all them, doing more health fairs. We also, in the past, we've because of limited staff, we get invited to other health fairs, in other areas by other tribes, because we have Kiowa tribal members outside of this area. So when we get invited to these other health fairs, we try to go and participate. And a lot of times when we are able to, we have a lot of tribal members that are happy to see us there. So starting to get out more and making that presence. And if they have questions at that time, they're able to talk to us, and we're able to answer their questions and refer them and give them, resources that we have available to them as well. So I think staffing, that's something that I'd like to see grow, is our staff, so we can provide more of these services to our people.
Okay. So a question I have is, if a person needs to contact CHR, what's the best mode of communication to utilize?
I would say the email. We have a CHR email, chr@kiowatribe.org. And that's, any of us can access that email. So we all have, we can go in and check that. We check it periodically throughout the day. Our phone lines, we've had a lot of issues with our phone lines, and a lot of people cannot get, currently right now, my phone line is out. My phone is not working. So if someone tries to call me, they can't reach me. So I just ask for their patience, as we get these little things worked out and stuff, and they get to it to fix it. But I know that the calling here has been a very big challenge for a lot of our people, because it's hard to get to our offices because of the phone lines. So I believe the email would be the best solution to that.
Okay. So, as a director, what are some of the most rewarding aspects of being the director of CHR?
Working with our people. I love being able to talk with them, help them. I can use, if you don't mind, I'll use one example. I went out to check on a client, and they had called in. One of the family members had called and expressed some concerns. So, I said I would come out and see them and visit with them and talk to them. So as we were visiting and talking, I was able to ask them if I could take a look at their medication that they were taking and all. And as I went through their medication and stuff and all, I noticed that a couple of their medications, might be causing the problem that they were having. So I reached out to both doctors on both sides and let them know. And sure enough, that the one doctor was an outside IHS doctor, the other one was an IHS doctor. So, it's very important to educate our clients on, letting your providers know which medications you are taking. Even if you go to an outside provider, both sides need to know that, because those medications were actually causing a problem that could have been, keep them at a fall risk, making them dizzy and stuff and all. So just checking on that one thing and being able to visit with them, being able to find out what their needs are, and being able to go back and talk to my staff, call other partners that we have and collaborations that we have going on to see what we can find to help our clients. And it's very rewarding, when you're able to do that and you see that it's made such a big difference for them and all. Even, we can help them with, if they have, let's say they have an application that they're trying to fill out or paperwork that you're trying to fill out at the doctor's office. And sometimes they need assistance with that. They might not understand the question that's being asked. We are that liaison between the doctor's office and, our client. So, we can provide that help with them. And that's very rewarding, to be able to help them with their needs and stuff. So
About how many
I really,
clients does CHR currently serve?
we have, I would say, about 75 to 100, and that we have, it varies, because we do have, like I said, our SDPI program, which is part of the CHR program. And so it's two separate fundings. One is, the SDPI is a grant that we work with, but we have clients that utilize that service that not necessarily utilize our CHR services, because they're outside of our service area. But if they live in Anadarko, like I said, Oklahoma City, Tulsa, we can help them. So we count them as part of our clients that we service. So with that being said, it's a regular clientele and plus our regular clients that we transport. We have those that have no transportation at all. So I combine those two numbers together to reach that. So
Okay. And are there any, if a person was in your service area, are there any eligibility requirements they probably need to know about before they contact CHR?
in our service area, as
Yeah,
far as
if
the
a
CHR
person lives
program,
down, yeah.
no, as long as they're Native American. from any federally recognized tribe. We can help them within the CHR, boundary, within our service area. I'm sorry. Yes.
Well, thank you for your time today, Jeanie. I don't know, I haven't seen any questions pop up, but if there are any from, I know our outreach coordinator's on. She might have a question she wants to put in the chat. And I know Tara's also listening in. So is there anything from the District 7 office personnel that we might want to ask Jeanie, just to kind of, I know because they field a lot of the questions from our citizens. Citizens are always asking about different things, and so we've covered a lot of the services. And Manila has her hand raised, so let me get Manila on here. And we're just gonna ask a question. I'll just go ahead and allow her to talk. Manila, you should be able to unmute and ask your question. Oh,
Can you hear me?
yep,
Can you
Yes.
hear me?
Yes.
we hear you, Manila. No, now you're muted.
Okay,
Gotcha.
can you
Go
hear
ahead.
me?
Yep, I can hear you good. Well, I hear her. Maybe she can't hear us.
I cannot hear her.
Oh, you can't hear her? Well, I know Tara had she wanted to talk about, there was a survey out on the website, Jeanie, while we're waiting on Manila. You want to talk about that survey and how it would be helpful to the program if people could fill it out?
Yes. Currently I will be working with our IT to our media department to possibly revise that and put a new one out, because when that was put up, I don't have access to gather that data. So we will be changing that and revising it. But it is a good survey. So currently right now, if it is filled out, I don't have access to it to get that data. So we'll have it taken down and we'll put a new one up. And then once we put that new one up, the surveys, yes, they will definitely help us. They will help us with finding out what the needs of the people are, to try to, if there's increased services that we need to provide for them, we will know how to ask for that with our funding. Go back to our funding agencies, and let them know that, these are the needs that we have. If it's different from what we are doing now, we can increase those services and try to get funding, to help our people. So the survey will be important, but thank you for asking that, because that's one of the things on my list, is to change that survey.
Sure. Manila, are you able to ask your question now?
She said you have her muted.
Nope, she's unmuted. We hear her. Something's, I don't think she can hear us. Go ahead, Manila. Okay, well,
I'm gonna have her type her question. I'll read
okay.
it out.
So I'll ask another question while we're waiting on Manila to put in her question in via chat. We covered like the some of the successes and things that have been rewarding to you. Is there any kind of advice you would give to our tribal citizens as far as like what they can do to access maybe some health facilities around the Anadarko Mountain View area? Like, is there any gyms that are available to them or places they could walk?
And Anadarko, the Wichitas have a gym. They have a fitness center. You do not have to be a Wichita Tribal member. You just have to go in and fill out, their paperwork, their forms, and, meet their guidelines. But there's that available at the IHS facility. There is the Good A Wellness Center that's there, and they can use that facility as well. As far as walking, I know a lot of people utilize the Ramlet Park area to do some walking and stuff and all, and just make sure when you do get out and walk that you're observant of your surroundings and make sure that you've got a good surface to walk on, that there's free of holes and loose gravel and stuff like that. Be very careful when you're out walking. Walking is good, but also be aware. Just be aware and be safe when you're out there walking. As far as Mountain View, there's a park there, Mountain View. There's a road. There's not a walking trail. But I will say this: we are currently working on I know the transportation department is working on getting a walking trail here on our facility, so on our grounds, on our tribal grounds. So we will have that hopefully within the year. I'm not sure how long the construction will take on that, but I do know that they will be putting that in. So that's part of some of the funding that we've had to be able to bring that, to our people. So we'll have a nice area to be walking on. So that's I'm excited about that. We'll have a walking trail.
Okay. Manila's question, she went ahead and typed it in. It says, what background does a person need to have in order to be a community health representative?
Well, you would need some type of experience. Currently you can go and get training online for that. And I worked for IHS for a little while in that area. I worked previously as a CHR in the past as well. And I found it very rewarding to be able to help, and help people. So a lot of our, there's not a criteria per se to get started. Let's say you're interested, you have an interest in that field and you want to go into community health work. Well, you can apply and you can get training to do that. So as far as background and stuff and all, I think it's just a matter of knowing that in your heart that is what you want to do, to want to help your people and have some form of knowledge of what that work is. And, as far as the medical side of it, there's no degree or anything like that to get started in community health work. It's just having that desire and that love, to want to help your people. Because it really is, I believe that there's that connection that you have, already. So the training can come, along as you become a community health worker. There's trainings that go on all the time to help us assess our skills and to learn more about it. The current what's out there currently in the medical field and our healthcare, to getting that health education, because you want to take it back to our people and share that with them. And also we're always getting trained for that.
Okay.
I hope that answers your question.
Yeah, it does. I think it does. Well, I appreciate your time today, Jeanie. And I think our office staff has been listening in, and I think they feel maybe a little bit better equipped to kind of answer some questions. We do have one more question. It said it mentioned health and nutrition education. Is health and nutrition education, is that something that CHR does? Or do they work under the tribe, or is there a contracted service?
No, we do provide health and nutrition education.
Okay.
So we will be implementing some of those things. Like I said, our staff is being trained right now. I do have one member of our staff that we just completed training for a DPP program, and it's a lifestyle coach program. So that's going to be a service that we will be providing at the beginning of the year. And we're very excited about that. It's in the works. We got, we're establishing our guidelines for that, and we will be putting that out there. But anytime anyone calls and needs that type of education, we can work with them on providing them that education with nutrition and health. So whether it be diabetes, high blood pressure, nutrition, diet and exercise, we have all of that information to provide to our clients. And we will be doing more of that type of education, to our people. So just yesterday, we did a falls prevention. I worked with Darren at the AOA program. Mr. Zotai, he's the director there. And with one of the collaborations that I have with the Oklahoma State Department of Health and the IHS in Lawton, we brought a falls prevention presentation to our elders there yesterday. And they really enjoyed that. We also have done a Tai Chi. It was an 8-week Tai Chi class that we did with our elders for falls prevention. It helps with balance and movement and all, and they really enjoyed it. So we are working to do another 8-week program. So there are various programs like that we're going to start bringing and implementing as we continue to grow. Like I said, myself and the staff, we're growing together. And we're hoping to make this program very successful and beneficial to our people as we move forward. So.
All right. Well, thank you very much, Jeanie, for your time today. For the citizens that are listening in, we're going to go ahead and finish this recording today, and we'll post it to our YouTube channel. But thank you for all the information. I know I learned a little bit more about what CHR is, who you are in your role, and how we can connect citizens to the program moving forward. So I appreciate your time today, and
Thank
I look
you.
forward to doing some more collaboration in the future.
Yes, thank you so much for having us.
Just a reminder, if somebody is listening in that might want to contact CHR, the email is chr@kiowatribe.org. Kiowa Tribe is all one word. So that's the best way to contact Jeanie and her team in the Community Health Representatives Program. So thank you all for your time today. Anything else, Jeanie?
I do have one announcement, if you don't mind. Well,
Sure.
actually a couple. On October the 11th, we will be having our flu vaccine clinic and that's a service that we provide with through the Lawton service unit. They'll be coming out, the public health nurses will be coming out to do the vaccines and stuff. So anybody that, would like to come can get their flu vaccines at that time. And we will be putting out some more dates and locations according to their schedule once we, work together to do that. And we're also going to be having a women's health fair. That's going to be October the 10th, and that'll be here at the Red Wolf Community Center in Carnegie. So that'll have it's going to be we're hoping it'll be a very successful health fair. It was really good last year. We had a lot of participants, and we're looking to do it's Breast Cancer Awareness Month. So we're going to do a health walk during that time and all in regards to awareness for breast cancer. So those are some 2 things that'll be upcoming. So I'd like to put that out there for.
There's also a bike ride too. Do you know any more details about the bike ride? If not, I can.
I know it's on the 19th. They are putting out a flyer for that.
Yeah, it just came out this morning, I believe. I saw
Yes.
it via my email, and I think it was it was October the 19th, and it's called the Tour of Rainy Mountain.
Yes.
So if you go to the Kiowa Tribe, I think the Facebook page just posted some information about it this morning. Let me go ahead and try to pull it up real quick, just so we can let people know about it if they want to travel in or take part in the bike ride. Give me just a second. I'm pulling it up right now. I should have had this already out. I know the education agency shared it.
Yes.
Now I probably won't be able to find it. Well, October the 19th, if you check the Facebook page for the tribe, you'll see a lot of it being shared on the information. I think there's like a 6 mile bike ride, a 12 mile bike ride. I think it goes all the way up to 30 if I'm not mistaken. So just make sure you're checking the Facebook page. That's going to be October the 19th around the Rainy Mountain area.
Yes.
All right. Well, thank you very much, Jeanie, and we'll let you go and appreciate your time.
Right. Thank you for having me.
Oh, here's, hang on a second. Before we go, somebody just sent me the information. It's October the 19th. The tour of Rainy Mountain Bike Ride, 8 a.m. It'll be a start point at the Kiowa County Courthouse in Hobart, Oklahoma. The distances will be 6 miles, 10 miles, 16 miles, and 32 miles. And there is an entry fee for $25. You also get a t-shirt, medal, refreshments, and a pickup at the turnaround. So it's free to all Kiowas, is what they say. So, all righty. All right, Jeanie. Well, thank you so much. We'll go ahead and stop the recording. And
Okay.
we want to wish everybody a great rest of your day. I hope.
Oh,
Thanks, Jeanie.
you're welcome. Thank you.